Good morning. My name is Kara Markin. I'd like to start by thanking the selection committee for inviting me to be here today. I'm an internist and assistant professor at the University of Nebraska Medical Center. I'm also a diplomat of the American Board of Lifestyle Medicine. Today I'm going to talk about lifestyle medicine and cancer risk. I have no financial disclosures or conflicts of interest. To start, I'm going to define lifestyle medicine. My goal is for you to be able to broadly understand lifestyle medicine and differentiate it from conventional medicine. Next, I'm going to introduce epigenetics and talk about what epigenetics is, how lifestyle influences epigenetics, and how epigenetics influence cancer. Finally, I'm going to introduce the American Institute for Cancer Research and its 10 recommendations for cancer prevention. Lifestyle medicine focuses on the use of evidence-based lifestyle interventions to prevent, reverse, and treat chronic disease. The interventions include a plant-predominant diet, physical activity, sleep, stress management, avoidance of risky substances, and positive social connections. The goal of lifestyle medicine is to put as much focus on these lifestyle interventions as we do medications and procedures. Lifestyle medicine emphasizes patient engagement and responsibility. There are multiple guidelines that support the use of lifestyle to effect positive change. For example, the American College of Cardiology and the American Heart Association have joint guidelines on the prevention of cardiovascular disease. In their recommendations, 6 of the 10 are based on lifestyle. Their shared guidelines on management of high blood pressure include lifestyle intervention as the #1 recommendation prior to use of medication. The American Association of Clinical Endocrinologists and American College of Endocrinology have joint guidelines on type 2 diabetes management, which includes addressing lifestyle as the #1 recommendation, again prior to use of medications. The American Cancer Society publishes guidelines on lifestyle interventions that are supported to reduce cancer risk. We know that lifestyle makes a difference, and it is reflected in major guidelines and recommendations. The problem is that in our society of quick fix, we often gloss over these recommendations and jump right towards the medications and procedures. Or even with well-intended providers, there's a lack of education on what the evidence is for lifestyle interventions and how to counsel patients to make these changes. There are a lot of fields outside of what is considered conventional medicine. These fields have a lot of overlap, but they are also distinct from each other. Conventional medicine is the traditional model, which tends to focus on alleviation of symptoms with the use of medication and procedures to resolve these problems. In this field, the patient is seen more as a passive recipient of care. There's absolutely a role for conventional medicine. I practice conventional medicine myself. But as I also discovered lifestyle medicine, I liked the model of a patient being the driver of his or her own care, with the physician providing the evidence-based recommendations and encouragement. Other fields you might have heard of include complementary or alternative medicine, which use techniques such as Chinese medicine, acupuncture, chiropractic medicine, naturopathy, reflexology, in addition to or in place of conventional medicine. Integrative medicine addresses the whole person and putting increased emphasis on social, environmental, mental, and spiritual needs. Functional medicine focuses on cellular metabolism and the physiologic and biochemical processes as drivers of disease. Mind-body medicine helps individuals manage symptoms and their response to symptoms through various modalities. Finally, preventative medicine focuses on the prevention versus treatment of disease. So this is, for example, the use of vaccines or screening tests in a public health role. The 6 core pillars of lifestyle medicine, nutrition, sleep, exercise, substance use, stress management, and social connection are built upon the mountains of growing evidence that certain behaviors in each of these fields is associated with positive health change. The evidence in the literature is growing. Just this morning, there were nearly 65,000 entries when I looked up lifestyle medicine on PubMed, 10,000 of which were published in the last year. Most of these papers focus on the treatment, reversal, and prevention of chronic disease. For example, diabetes, high blood pressure, obesity. But there's a lot of interest in how lifestyle medicine can be applied to cancer, in particular, the prevention of cancer. So when it comes to cancer incidence, what happens when people follow lifestyle behaviors? In this 2012 publication, which followed 386,000 individuals from 10 European countries over 11 years, it evaluated their degree of adherence to the World Cancer Research Fund guidelines, the ones we'll talk about a little bit later, including things such as weight management, physical activity, nutrition, alcohol use, and breastfeeding. They found that the risk of acquisition of certain cancers decreased the more one adhered to these general guidelines. On this graph, the horizontal black lines to the left of the yellow line suggest a decreased risk, and those to the right show an increased risk. Those across the middle in this slide are pancreatic, prostate, and ovarian cancer did not show a significant effect from interventions. But overall, you can see at the top, circled in orange, the risk of developing one of these cancers is reduced with adherence to lifestyle recommendations. In another study of the same sort, this one published in 2015, 476,000 individuals were followed for nearly 14 years, and they were measured with their adherence to the American Cancer Society recommendations for lifestyles and behaviors that reduce the risk of cancer. The recommendations were relatively the same with the absence of the recommendation on breastfeeding. Again, the lines to the left of the middle suggest a reduced risk of cancer, and the lines to the right suggest an increased risk of cancer. And those across the middle do not show what would be considered to be a statistical difference. But again, if you look at the bottom in the orange circle, you can see that overall, cumulatively, the risk with adherence to these lifestyles is less. So from these two studies, we do see there is an association between behavior and cancer risk, but how and why? One of the first studies to explore this was from the 1980s. It followed Japanese immigrants as they came to Hawaii. During the 9 years participants were followed, they measured the incidence of stomach, seen in blue, colorectal, seen in black, and breast, seen in pink, cancers. Interestingly, the longer a Japanese immigrant stayed in Hawaii, the more their cancer incidence began to mirror those of native Hawaiians. While native Japanese individuals had a high incidence of stomach and low incidence of breast cancer, living in Hawaii seemed to confer a reduction of the stomach cancer and an increase in breast cancer, suggesting there was possibly an environmental factor at play, not just genetics. And when I say environment, I mean our exposures, which may include things like diet, which was suggested by these studies. So how does environment actually play a role? A theorized mechanism that is being explored is something called epigenetics. Epigenetics is the study of molecular mechanisms that modify chromatin, which is packaged DNA, in a way that is stable or heritable, meaning it can be passed on as the DNA replicates, that brings about changes in gene expression without altering the DNA sequence. So a quick recall here, back to biology. Humans are made up of 23 pairs of chromosomes, one from each parent. The basic unit of a chromosome is the DNA, which you see up top. DNA contains nucleotides, the order of which determines your genetic code. Will you have blue eyes, brown hair? Are you tall? Do you have a predisposition for high cholesterol, etc.? DNA is wound around proteins called histones. The histones are bundled together in chromatin. The chromatin is then wound into your chromosomes. Epigenetic changes are thought to happen in one of three ways. Modification of DNA, which you see at the top with that little orange methyl group. Modification of the histones, those balls there that are the coil of DNA. Or modification of RNA, which is the mechanism by which DNA makes proteins to aid in gene expression. Epigenetic changes, for example, the modification of the DNA, histones, or RNA, have been shown to affect our biology. In this kind of busy diagram, the little gray bubbles that you see within the green bubble represent specific epigenetic changes. And the big green circles are things we know that are affected by epigenetics. The top left shows cell differentiation, which is the ability for a cell to change into something specific. And the bubbles on the top are changes that we know promote cell change. And the bubbles on the bottom are things that slow or stop cell change. On the top right, we see immunity. The gray bubbles on top are epigenetic changes that promote immune activation. The gray bubbles on the bottom are things that result in immune suppression. Finally, on the bottom, we see cancer and epigenetics that affect tumor growth. Again, the gray bubbles on top promote tumor progression. And the gray bubbles on the bottom are epigenetic changes that lean towards tumor suppression. This diagram shows what we know about the way environmental factors, so things you see around the edge, for example, the ketogenic diet, exercise, your microbiota, dietary fat, alcohol use, what we know about how these things cause or regulate epigenetic modifications. So these are things that actually make the changes that we saw on the prior slide that can result in things like tumor suppression or tumor suppression. We know that lifestyle then affects epigenetics, and we know that epigenetics results in disease states, including cancer. The question then is, how do we apply this to reduce our risk of disease? A lot of the evidence that examines the direct link between the two tends to be on the extremes of ends. For example, how fetuses are affected by maternal starvation or are in animal models. But the more we can begin to understand how and to what degree lifestyle changes result in the epigenetic changes that may result in cancer, the better we are equipped to change behaviors and habits and emphasize public education to reduce morbidity and mortality from preventable causes of death. So as we are learning more and more about the mechanisms of how and why, the World Cancer Research Fund International, a network of multiple national organizations worldwide committed to reviewing the literature on lifestyle, in particular diet and activity, reviews the evidence and compiles what is known as the Continuous Update Project. It is the most comprehensive and regularly updated review of evidence linking lifestyle behaviors, specifically diet and physical activity, to cancer. A team at the Imperial College of London conducts systemic literature review for 17 different cancers, as well as one for breast cancer survivors. They gather the best available, most current evidence from around the world. It is peer-reviewed by external reviewers. Then the International Agency for Research on Cancer reviews the suggested mechanisms to support the evidence. Finally, the Continuous Update Project panel, comprised of independent experts from around the world, evaluates and interprets the evidence, making judgments about the strength of the evidence and whether there is strong evidence that a particular risk increases or decreases the risk of particular cancers, or have no effect. These recommendations are then published for the public. This matrix shows the basis for the recommendations. If the evidence is judged to be convincing or probable that an exposure increases or decreases risk, it is considered strong evidence and used for the recommendations. These are the 10 recommendations that we will now run through. The first recommendation is to be and to maintain a healthy weight. The review literature associates an unhealthy weight with 12 of the 17 studied cancers. The Continuous Update Project panel has made special note that there appears to be a link between body fatness and susceptibility to cancer, as there seem to be some metabolic and endocrine abnormalities associated with obesity, such as fasting insulin or estrogen levels, as well as inflammatory mediators that also seem to promote tumor growth. For this reason, a lot of emphasis is placed on recommendations that decrease the risk of becoming overweight or obese. And overall, the recommendation is to keep your weight within a healthy range. The next recommendation is to be physically active. The panel notes that being physically active is associated with a decreased risk of certain cancers. As well, it is indirectly positive because of the lower risk of being obese or overweight, which indirectly affects cancer risk, like we discussed. Recommendation 3 is to eat a diet rich in whole grain, vegetables, fruits, and beans. Specifically, reduced risk is associated with consumption of 30 grams of fiber per day and taking in 400 grams of plant food per day. Recommendation number 4 is to limit fast foods, primarily due to its association with obesity and overweight. This, as we know, is a big part of the Western diet. We also know that an elevated glycemic load in food, including fast food, increases the risk of uterine cancers. The recommendation really is to limit the consumption of fast foods and other foods high in fat, starches, or sugars. Similarly, recommendation number 5 is to limit or avoid the consumption of sugar-sweetened drinks, again associated with weight gain. Recommendation number 6 is to limit alcohol consumption due to its association with certain cancers. Interestingly, there appears to be a protective effect of alcohol with kidney cancer, but this benefit is outweighed by the risk of other cancers with alcohol consumption. Recommendation number 7 is to limit the consumption of red and processed meats. Processed meats have been classified by the World Health Organization as a class 1 carcinogen, which is the same class as tobacco and asbestos. Red meat is listed as a class 2A carcinogen due to increased risk, but also from limited evidence. However, the panel recognizes that red meat is a good source of iron, protein, and micronutrients for a lot of the population. So in moderation, perhaps 3 times a week, red meat is okay to eat. Recommendation number 8 is to avoid the use of supplements for cancer prevention. There really is no supported role for the use of supplements to prevent cancer, and we should aim to get our nutrients from a balanced diet. We just don't have the evidence that there's much of a benefit to this. And for some high-dose supplements, there are actually serious risks, which at this time outweigh any possible benefit. Of course, some individuals do need supplemental nutrients. For example, if treatments or surgeries have affected absorption of minerals from the diet, but these are really exceptions. The 9th recommendation is that for those who can, breastfeed. Breastfeeding is protective of the mother with a decreased risk of breast cancer and protective for the baby with a decreased risk of obesity. Finally, for cancer survivors, most notably breast cancer survivors, which are studied by the panel, they recommend trying to follow the 9 aforementioned recommendations, as there's growing evidence that physical activity and other measures that control weight can improve survival and quality of life, not to mention decreasing your risk of future disease or another primary cancer. So today we discussed lifestyle medicine. which is the use of evidence-based lifestyle recommendations, including diet, activity, sleep, stress, substance use, social connection, to prevent, reverse, and treat disease. We talked about epigenetics and acknowledged that lifestyle can result in epigenetic change, and epigenetic changes are associated with certain disease states, including cancer, and that we are still learning to what degree our lifestyle behaviors can augment our disease risk. Finally, we reviewed the recommendation for cancer prevention from the Continuous Update Research Project, including these 10 recommendations. Be a healthy weight, be physically active, eat a diet rich in whole grain vegetables, fruits, and beans, limit consumption of fast foods, limit consumption of red and processed meat, limit consumption of sugar-sweetened drinks, limit alcohol, do not use supplements for cancer prevention, breastfeed if you can, and if you have a cancer diagnosis, try to follow these recommendations if you can. The last thing I'd like to say is that life happens outside of clinic. As physicians, our job is to help our patients achieve their best quality of life. If we can encourage small behavioral changes that result in improved quality and quantity of life, that's a job well done. If we can reduce cancer diagnoses and decrease the risk of chronic disease in the process, that's what we want. Here are some references from my talk today. And thank you so much for your time and attention. I'm happy to answer any questions.